Hello, thank you so much for visiting Advocate Healthcare Consulting. My name is Sandy Williams and I am the principal of this organization. I have spent numerous years in the healthcare industry, both as a consultant working with individual physician owners and medical groups, as well as in a leadership role working for a large healthcare insurance company. I believe this has given me a unique perspective, certainly understanding the side and the challenges that a medical group physician clinic has to address on a day-to-day basis, but also understanding the payer side. And so I was inspired after having all this experience to create this organization to help support you. And when I say you, thinking of the individual physician owner, the front office, the back office, the revenue cycle supervisor, the practice manager, the authorization person. There's so many ways that I would love to be able to help make your practice more efficient. Just really working in partnership to create to work and find the best resolution for those areas of concern. There are four areas of focus. The first is practicing management, really helping, whether it's creating efficiencies in the operations that may be lacking, or just working on improvement in general, or doing a check to make sure that things are in compliance. The second area is compliance. Compliance seems to be that one area that's always on everyone's to-do list, and I understand that. There's so many things to deal with on a day-to-day basis, but creating those policies and procedures for compliance to make sure that you have those. So in the event that you're audited, that you have those in place. And to prevent an audit, to make sure that coding and billing is done correctly, to make sure that their write-offs are at the percentage that you want to have for your practice, or having compliance if you have telecommuters in your practice. Often I found that the telecommuting portion is left out of that. So just helping, again, working in partnership to create those so that you know that those are in place for your practice. The third area is revenue cycle management, whether it's chart audits, whether it's coding and billing principles, whether it's understanding the new coding changes so that you can make the best changes. Are you being paid according to your contract as well with all the payers? So these are just some of the areas that I want to be able to assist with. As we all know, rev cycle and your contracts are bottom line. I will say, in my time with a large insurance company, one of the things that I observed is the lack of knowledge of the contracts as it relates to the payment. So I think they definitely have some great tips to help support in that area. The final area really is patient engagement. There's so many changes in healthcare, as you know all too well, but there's also changes in choice, whether practices are going either merging with another group or going into concierge medicine. How do you keep your patients engaged? How do you keep them working in partnership for total care? Maybe it's a site that you've not updated in years that you want to creating a portal for your patients to go to. How do you engage with them to again have that better relationship, or things that or just a brief summary of things that I would love to be able to help with. I am excited to hear from you, to be able to support. Again, my philosophy is all about, number one, listening to what the concerns are. I don't come in and make assumptions. I first listen to you, because there's nobody that knows the issues that exist better than you. The second, it is a partnership. I enjoy working side by side with that person toward the desired resolution. And to me, and really making sure that practice or that issue is addressed, and there are checks and balances along the way to make sure it is a long-term fix. Thank you again for your time, and I look forward to hearing from you. Thank you.